Hello, this is Gary Crowley with DoItYourselfJointPainRelief.com, and this is video 3 of 4 videos for upper left back pain relief. In video 1 we released a lot of these upper left back muscles with a sports ball, in our case a tennis ball. In video 2 we released a lot of these muscles on the front of your chest that can be yanking on your upper left back and causing your pain. And now in video 3 we're going to release a bunch of muscles on the side of your shoulder blade and on the inside of your shoulder blade and down here that attach to your shoulder blade. They can be basically yanking on that shoulder blade and causing you to feel discomfort or pain in your upper left back. So basically the first muscles we're going to go at are your Teres major and minor muscles. They're kind of like a roll of dimes or nickels, depending on how big you are. But they just run along the very side of your shoulder blade. And when they get tight, they can torque that shoulder blade and make you feel that in your upper left back. So what I do is first you want to locate them. And again, side of your shoulder blade, there's that meat, that flesh in the way there. And just locate them a bit and notice how tight they are. Press on them, find some tender spots. And then I just do a press, pull, release on them. I do press, pull, release, press, pull, release, press, pull, release. And when I'm working on them myself, after I'm done showing you, I tend to hang my hand over my opposite shoulder. That lets all this kind of relax. And then I can get in there a little easier, as long as you can reach around this far. And I just do press, pull, release, press, pull, release, press, pull, release. Maybe a little press, hold, move, but on these Teres muscles, I don't know, I kind of like a press, pull, release. And then as soon as I say that, I want to start doing that, of course, right? But just do a little press, pull, release. You can even let it hang a little bit once you know where those are. Press, pull, release, press, pull, release. And just dig on them until they start to let go. They can be very, very tight. Computing and driving can make these very, very tight, along with basically the next muscle we work on too. But that's your Teres major and minor. You can work on them this way. I don't find they let go quite as easily when your arm's up like this, because they're kind of, there's no give in them. You put it down here, wrap it around here, let it hang. I like to wrap. Do that. You can do a little press hold move. But that's your Teres major and minor. Now your subscapularis, a little trickier. So here's your Teres major and minor. Come to the inside of them, about an inch or so, and then you're going to shove your fingers in, basically to your armpit, but not into your armpit. You're going to come just to the inside of those Teres muscles and then shove your fingers in there like you're trying to touch the back of your shoulder blade. And when you do that, you will run into your subscapularis muscle. And now it's actually easier to get in there with your arm down. So you kind of find it here, but then put that arm down, you'll find your fingers slide in there a lot easier. And then on this one I do like a little chicken wing kind of move, because it gets that muscle to move in a way. And this one's pretty tight on me, actually. And it's letting go, but yeah, I haven't been in here in a while. And whew, and this one could be a little bit of a zinger, so take your time with it. But it's letting go. And you kind of got to be a little bit of an investigator. The way you use your body will depend on the way it gets tight. And so you notice I do this, I do this. You notice what your body likes to get that muscle released. And once your cerebellum gets the message that you're pressing on this muscle and you want it to function, it will tend to let it go. So yeah, so on the Teres muscles that we just did, I tend to like press, pull, release, press, pull, release. But on this subscap muscle deep in here, I like a press, hold, move. It's hard to do a press, pull, release on that. Whew. So that's actually a lot better. But again, I'm going to make a mental note. This lower part, I probably need to come back and check on that maybe after we've done all these videos. Now the last muscle that can yank on that shoulder blade and affect this upper back is your Serratus anterior. And basically, again, here's your rib cage, here's your rib cage, here's your shoulder blade. My shoulder blade basically comes down to about there. This muscle is basically just below the tip of my shoulder blade, comes and is all up here in my ribs. It's like a big rack of bananas that comes off and grabs your ribs. And so what you want to do is, again, just press in here. Now if you stretch way too much, it's kind of hard to get over there. But if you kind of keep this arm up here, I like to wrap this around the other side of my neck and then reach around with my fingers and find any tender spots. Now for a lot of you, these will be really, really tight because no one's probably ever worked on them. I call this the forgotten shoulder girdle muscle. And you can reach around here. You might, if it's too far, you can have somebody dig on there. But, do it at your direction, not theirs. And when you find a tender spot, there's a little spot for me that's tender. Again, press, pull, release, press, pull, release. You can do a little press, hold, move, but I like a press, pull, release on this serratus muscle. And you're just going to come from here, you're going to come all the way up, those ribs, and you'll feel when it's tight. Like, I'm not really that tight up here, but right here, there's a little lump of muscle tissue that's kind of balled up there. You feel it. And you just work on it a bit, and there it goes. But again, I've been in here a lot in my life, so it lets go a little easier on this particular muscle. But take your time, dig on that. You can wrap this around your other shoulder just to... You got to try different things for your body. Some people say I'm bendier than they are, they can't do this, but just find whatever works for you, and it may take a little longer, or if you get a little less pressure, but you can do it. Or, again, if this is a tough one, you can have somebody dig on this, but again, make sure they know that they have to follow your directions. It's not, a little session to tickle you until you submit, so, which happens in this area for some people. So, okay, so Teres major minor, and Serratus anterior, and subscapularis in there. You release those. Now you self-assess. How much did it help your back? For some people, boy, unhooking this stuff, their back completely lets go, and they'll know that that's probably from mousing too much or driving too much. So if you go on a long trip or you're computing a lot, you might want to reach in there as a preventative thing. And but notice how much that helped your back. Notice what you need to come back and do. I got a little spot maybe in my subscap here that I could probably come back and do a little more work on later. And especially if my upper left back is bugging me. And that is video 3 of 4. So do your self-assessment, and I will see you at video 4. Thanks.